Assalamu alaikum. Your question is very valid. Distinguishing between these four involves evaluating the opacity shape, its relation with the mediastinum, and few signs on the chest X-ray. So if you know that pleura is a potential space, and when it contains fluid more than 0.25 ml of the body, and particularly 10 mm from the chest wall, then it's become clinically significant. So because it's outside the lung, and when there are no loculi, it always gravitates and exerts pressure on the surrounding structures. And one sign, this is concavity upward and pointing towards the axilla, is meniscus sign. And its mediastinal relation always depends upon its size. So if it is large, it will push the heart and the trachea away from the center, and otherwise it will just lead to same side costophrenic and cardiophrenic angle obliteration. And it will be homogeneous opacity with no intervening other signs, as it is outside the lung parenchyma. Then consolidation, prototype is pneumonia. So particularly it happens when there is inflammatory fluid in the alveoli, and sometimes hydrostatic pressure leads to accumulation of fluid, and sometimes autoimmune diseases leads to accumulation of blood. So all these will give rise to air bronchogram, and you well know what is air bronchogram. These are visible air-filled bronchi outlined by the surrounding opaque alveoli because of these exudates and inflammatory or hydrostatic whatever. And their relation to the mediastinum, practically there is no relation. The lung volume relatively remains unchanged, so the other structures they seems not disturbed on the chest X-ray, and the margins they are usually ill-defined if it remains within the one lobe. So once it reaches at the level of different sulci, you will see a sharp demarcation. Otherwise, there will be fluffy shadows. Then collapse is the one where there is loss of volume, and unlike these two things which we have discussed, it causes the pull effect. So there will be loss of volume on the chest X-ray, and it has a definite relation with the mediastinal shift, and diaphragm will be affected, and the ribs will be crowded because there is no pressure on them to remain open. So in nutshell, this chest X-ray has a dense opacity in the lower zone of the left chest, and there is obliteration of the left costophrenic angle, and the superior border appears to have a meniscus line curve, and it's pointing in towards the axilla. And mediastinum is also not significantly shifted, which means that the volume is mild to moderate. And the rising lateral edge does signify that amount is more of moderate rather than mild. So proceed as I told you. I am Professor Dr. Javed Iqbal speaking. Hope you understand now these three things.